Bob and Brad, the two most famous physical therapists on the internet.
Hello, Brad Heineck, physical therapist.
Hey, I'm Chris the Pharmacist.
And what we have today, we're going to talk about congestive heart failure. As a therapist, over the last 25 years, I've worked with many people, particularly elderly people, with this diagnosis. So it's very with therapists, you deal with it oftentimes. But as a patient or people out there, Chris is going to go through the details. He's done a lot of research and talk to you about what it actually is, how it's treated, and I'll interject a little bit about what we may do with therapy in regards. So let's take it away, Chris.
All right. Well, congestive heart failure or heart failure. That's kind of the topic of discussion today, guys. I guess the simple understanding of it is, our heart, it's a pump. It's one of the muscles that just never stops in our bodies. That and our diaphragm, basically, I think about the only two that I can think of. Well, digestive, but that said, it's constantly pumping all the time. And what happens with that particular pump is it doesn't pump properly for our body's needs. And so then when it doesn't work properly and you're not getting good circulation, congestion occurs. So just like a runny nose or congestion in traffic. And so fluid builds up, and basically that creates a lot of damage, weakness to the heart, and a lot of other problems and complications associated with it.
So in other words, the heart, for it could be a number of reasons, is not efficient anymore. It's not pumping out enough blood, or it's not receiving the
little bit of both. But I mean, at the end of the day, the heart, I guess if we're going to start at the pump, it's the heart just for a variety, and there are multiple reasons. We'll kind of touch on how and why it got there. But the reality of it is that the body has needs. It has to get oxygenated blood that carries all the nutrients and everything else. And when it's getting when the pump is weakened, it doesn't make it all the way through the loop to get back. And so as a result of that, you're going to get fluid back up. And a lot of people, when they present to a hospital at that point, because usually it's going to be like if it's an acute crisis, they're going to have swollen hands, feet, probably difficulty breathing, fluid in the lungs directly. They can be coughing up kind of pink sputum. So,
and this is all due to the heart being weak.
Yes. As a result of it, the heart is failing. The pump itself, for a variety of different reasons within the heart, whether it's the heart muscle itself getting too thick, the septum which is what divides the chambers in the heart, getting a little too thick, it can crowd. And then so what happens is, and when they base it on diagnosis, and you and I were talking about ejection fraction, what happens is that pump, when your heart, if this is, let's say your left ventricle, we'll pretend it squeezes, it doesn't necessarily squeeze completely because the contractility of the heart muscle itself is either stiffened or it's not as flexible. So the heart itself is really supple, and it kind of constantly is moving. And so when it tries to fill up with blood, it's not stretching to fill that blood up as well as we need to, and then it's not contracting properly.
So we're talking about the blood on the left side of the heart, which is actually the oxygenated blood with nutrients that's going out to the rest of the body. And that's the system you were talking about. Throughout the whole body, we need that oxygenated blood. And after it's old, it comes back through the veins, and then goes back to the heart, and then to the lungs.
The right
that's
side,
the system.
And it makes a perfect loop. So basically, and that's the other thing we can talk about. There's left-sided failure and there's right-sided failure. And so, usually it's more common to have left-sided failure, and then right side can happen at the same time, or it can happen in and of itself. Again, a cardiologist would be breaking all of these things down. So but at the same time, what's important to recognize is that the heart itself is just not beating the way that it should and pumping the blood through the body the way that it should.
So you had mentioned some symptoms, I think, which is important. If people are wondering if their loved one, if they themselves or someone is having their swelling, is that always mean you have CHF? Or
no, I mean, generally it's a hallmark sign, but I mean, you're going to get probably a bunch of other things. I mean, and the problem is that, we have kind of an umbrella of things that can cause congestive heart failure, and start to finish. It's kind of a culmination of things that happened over the lifetime, but we see it in kids and pediatric patients that maybe have a genetic anomaly. So where something is abnormal with their heart, where you can see
and they're born with it.
Exactly. But what's most common is people over the age of 65, and that's
Okay.
usually when it's going to occur. And I mean, you're talking about roughly 600,000 Americans a year are diagnosed with it, and you got
And it's just generalized typical symptoms that
yeah,
may be from
yeah.
CHF.
So basically, a lot of people all of a sudden, man, my fingers are swollen. I can't. My wedding ring doesn't fit
Hmm.
properly, or wow, look at my feet. They look huge. And you see swelling all the way up the legs. You have a really plump, hard abdomen, so it's very full. Oddly enough, even though you can be gaining weight, significant amounts of weight. So, like all of a sudden, you can gain 2 to 4 pounds in a day,
Okay.
5 to 10 pounds in a week.
So that's fluid. That's
That's
not
fluid. It's not
fat.
you didn't eat so much that
Yeah.
you didn't have 6 pizzas. You weren't.
Retain the
Yeah,
fluid.
as a
Yeah.
matter of fact, when they're start to retain fluid like that, they are actually losing their appetite, maybe even feel nauseated.
Sure.
A lot of times, the complications are they can have some chest pains, difficulty breathing because there's fluid actually in those lungs, and
Yeah.
so it backs up. And so when you present to the emergency room, I mean, a skilled doctor is going to recognize it immediately. Actually, the nurses will recognize it immediately.
Sure.
But from and they're going to get the ball rolling. And there's a lot of things that happen when you're in an acute congestive heart failure
Okay.
crisis.
I do want to bring up one thing because so that people don't get too concerned as far as the ring becoming tight as one of the possible symptoms.
Sure.
I know, like my wife, she's got ring issues. We just got her a new ring. She tried to get it sized, and
Yep.
it's fitting tight. And I'm 99% certain she does not have CHF.
No.
So don't get excited if your ring starts fitting
it's
tight.
just an example.
But it's one of the things, along with maybe
Yeah,
other parts
and
swelling.
it's going to be profound. I mean, your fingers would kind of look like puffed up
Okay,
sausages.
sure.
So it's not going to be, because I mean, you could have a salty meal and your ring might not
Sure.
fit properly.
Yeah.
So I mean, and even as we age, I mean, if you stood on your feet all day, you're going to
Yeah.
have some swelling in your feet and ankles. I mean, that's pretty par for the course.
Any other pain symptoms that are typical?
I mean, you can present. I mean, you can be having a heart attack when you present to the office. When you go to
You're
the
talking
hospital.
about chest pain.
Yeah. So you can have chest pains. You can have the shortness of breath. You can have a cough. You can feel overwhelming fatigue in a lot of cases. And again, I think the other thing to delineate, there's chronic and there's acute. And it's a chronic progressive disease. And so, it's got categories. There's 4 categories.
And this is over weeks, months, or years?
Typically over the rest of your life. So
but I mean, to get it started, it like you said, it didn't happen overnight. It happened as a result of.
It happens over years and years and years. And so prevention, it's an ounce of prevention is a pound of cure is kind of the thing.
Is it typically lifestyle or is it genetic or a little bit of both?
Well, I mean, if you have a genetic predisposition towards heart failure, so your dad, your grandpa, your mom, I mean, there's going to be a high likelihood that it's probably going to happen to you.
Mm-hmm.
But what can you do to prevent that? Well, lifestyle changes are going to be number one. Stop smoking. Don't drink. Be the simple things that you can just cut out.
Right.
But then it's going to become staying physically active
Mm-hmm.
and eating a healthy diet. Probably lots more fruits and veggies. And if you look up the DASH diet, I think that's the diet that's most profound. It shows it's going to have a low salt.
Yeah.
It's
what does DASH stand for?
To be honest with you, I don't honestly.
But if you Google DASH diet,
it's DASH and it's capital DASH, and basically that diet specifically is low sodium, lean protein, lots of fruits and veggies.
Yeah.
That's the diet in a nutshell.
Sure.
And that's been championed by both the American Medical Association, the American Heart Association, you name it. They're going to stand behind it because they know that when you're eating that type of diet, the salt intake is at a minimum. So that's helping your heart. We're going to do a video about potassium in a little while, talking about the balance of that. So we'll explain that. But to a degree, while we're on the subject, I mean, when we have a diet that's higher that has natural potassium in it, it's going to help to balance your blood pressure out, which because, one of the causative factors of congestive heart failures is long, coronary artery disease, high blood pressure itself. So it takes, it can be a side effect diabetes. It could be organ problems.
Sure.
So you could have kidney failure leading to this. So it's not just a one size fits all example. Multiple things can cause congestive heart failure.
And that's the information when you see your doctor and you've been diagnosed, they're gonna look at you specifically.
Correct.
And we really can't do that here at all.
That's above our pay grade.
Right.
But I mean, the reality of it is that if you have the symptoms, you want to get medical treatment right away. You do want to see your doctor consistently as we age because these are the things that when they pick this up early, And that's the key.
Yep.
Is if we can pick things up early, maybe it doesn't develop into a full-blown
Right.
problem. And that's kind of the key.
Do you change your lifestyle things, your
do,
diet,
yeah.
your
And I
exercise?
mean, if you're listening to this and you're a young person, you know, get your exercise. It's going to be 30 minutes, 5 days a week, where you're sweating and breathing hard. You know, most days of the week. Usually 5 days is ideal if you can, but sometimes schedules are crazy.
Right.
Eating well, good food choices. I mean, those are gonna be kind of the
Sure.
things. So I mean, and it's not that hard, but it's, you know, we're busy, and the Americanized diet is not necessarily the most conducive because we're a busy society. But heck, Europeans are too. So I mean, it's not exclusive to just us.
So I just want to say, if you're, you know, 50s, 60s, you know, and you're thinking, and you're not an exercise person, you don't have to go out and exercise and get sweaty and breathing and put the sweatsuit on.
Nope.
If you're sedentary and you go out and you walk
Just take a
5
walk.
days a week, it's going to work great.
And gradually build. I think that's the important thing too, is Rome's not built in a day. So if you're somebody that's not accustomed to doing, and I think the other thing to support is, you know, find something you enjoy.
Right.
Yard work is a phenomenal workout.
Sure.
You know, so it's taking a walk,
Yep.
ballroom dancing, swimming, exercise bike, treadmill, lifting weights, all these types of activity. There's, you know, just find something that you can hold on to, that you know you can do, and vary it. Do something different. If you take one, maybe take a bike ride the next day if it's nice. You know, go walk on the beach. Walking in sand is tough because it's unstable. So I mean, it's
but, you know, and if you're at the level where you're watching this and your balance is not so good, you use a cane or a walker just to get up and move. And we have, you know, now I know our channel has a lot of videos for the elderly, but not just ours. They're all over the place.
It's for everybody.
Just to get up and walk, like where my mother lives, walking up and down the hallways because she doesn't get outside very much is wonderful. Wonderful.
Find a friend. A lot of times you're just a little, you can have a nice conversation while you're participating. So, but at any rate, long story short is, you know, you want to get out there and do. That's one of the biggest things.
Should we go into what some typical treatments that the doctor, if you're diagnosed, what they're going to talk to you about so you can understand it?
So once you've gotten the diagnosis of congestive heart failure, and once they've gotten you stabilized, because that's usually a pretty big deal when you go into the hospital with an acute crisis. So let's say you've come out, you're meeting back with your cardiologist.
So you need to say acute crisis, you're saying the swelling is there, maybe you're breathing.
They had to get your heart muscle stabilized. They had to do a lot.
If it's like a lot of people will tend to wait because they don't want to go in. They're going to say it's going to get better, and then they go in.
And that's, you know, there's actually a really good study that I read that came out many years ago in 2008, and it's you know, most people take about, you know, and it sounds like a short period of time, but 13 minutes. And so they'll sit there and bask, and I'm like,
13 minutes for what?
Just to try and, 13 hours. My goodness, 13 hours. They're just not feeling well. And they're like, you know, because again, you know, and whether it's a heart attack or congestive heart failure, I mean, chest pain, shortness of breath, fatigue, swelling, you know, all those things kind of come into it. You know, you got kind of that pale, you're sweating. You know, people just think, oh, I must have a little bug or I ate something funny because, you know, you don't always have crushing chest pain. Sometimes you do, sometimes you don't. Sometimes you get pain that radiates in your jaw. So these are all symptoms of heart attack too, guys. You can get pain down your arm. So it's hard to tell if you're having a heart attack, if it's leading into it. So again, the cardiologist is going to work. So, I mean, if you have any of these things.
I just want to tell this little story. You know, it's a blah, 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 but it's a good story. It's a true story. It was 5 years ago. We were up at a cabin, a bunch of guys. My father was there. He, you know, was 80, 79, 80 at the time. He wakes up. He went to bed early, wasn't feeling well, had soup with a lot of salt in it. Of course, we're out with the guys. We're not thinking eating healthy. We're just thinking having a good time. He comes down the stairs very wobbly, and it was about 10 o'clock at night. Same symptoms, kind of sweaty, not feeling well, couldn't even talk very well. It's like, this is bad. So we put him in the car. We didn't call the ambulance. Maybe we should have, but we drove and we called the ER and said, my dad's coming. He's got these symptoms. We had an RN there. He went with him. So it wasn't like we were all, and he had some ER experience. So got him to the hospital. They got him stabilized as they could, put him in a helicopter. Northern Wisconsin, small little hospital, couldn't do it. Put him in a helicopter, 2-hour ride in a helicopter down. And he ended up being fine, as, you know, not back to normal, but he was
Oh
stabilized.
yeah.
And then he eventually did get back to up and around, and he went back
Yep.
to the hunt again,
Yeah.
or cabin.
But I
But
mean, it's one of those things where, yeah, and you just, so people tend to put things off, and I think that the sooner that you can get treatment, particularly in an acute setting
yes,
where it's immediate, you know, I mean, there's nothing to be embarrassed about. I'm going to the doctor because I had chest pains, or I'm just not breathing well, or I'm not comfortable.
sure,
Go. I mean, let the pros sort it out. They're highly trained. They are gifted, caring people
right,
that are going to do the best things that they can do to get you stabilized
sure,
and hopefully minimize. Maybe it would be maybe a smaller problem to a much bigger one. That as time goes by and more swelling, more backup of bloods and fluids, it can create more damage.
sure.
And that's what we want to avoid.
Yep.
So the key is recognition early. And, we're not all trained to necessarily recognize,
No.
oh, yeah, I think I'm having a heart attack. Just understand chest pains, shortness of breath, fatigue, weakness, kind of coughing, weird sputum, things like that,
Yeah.
where it's just not natural.
Yep.
These are things that are, hey, this is a big red flag. And these are the things that we
Yep.
want to pay attention to get the care that you need. So once you get the care that you need and you get stabilized, the modicum on it's going to be medications
Sure.
and lifestyle changes.
Yep.
And the doctor's going to preach that. They're going to get you on certain blood pressure medications to
Sure.
try and ease the load on the heart, to slow down vascular resistance or lessen it, so that the heart muscle itself can fill up properly and pump more blood efficiently through your
Sure.
body to help to maintain that. And so we talk about degrees of congestive heart failure. American Heart Association uses A, B, C, and D.
Mm-hmm.
A being the best, which is actually a pre-stage.
Okay.
D being the absolute worst,
Okay.
which is kind of end stage. Or in the New York Heart Association, which is the other one, uses 1, 2, 3, and 4.
Okay.
And the stages themselves have little nuances in between. Your cardiologist has and your doctor will know all of these things off the top of their head.
Sure.
They're going to be using those as a part of their treatment plan to help you to live your best life.
Sure.
And at the end of the day, when we hear congestive heart failure or heart failure, it becomes a quality of life equation.
Mm-hmm.
And so we want to make sure that as patients, we want to make sure that we're maximizing the medications and doing our part. So it's eating well, it's trying to get exercise, what our bodies will allow. Because
Sure.
sometimes as we get further down into those levels of congestive heart, and you get into C and D
Mm-hmm.
or 3 and 4, it's much more difficult to do certain things.
Sure.
Walking upstairs can be a challenge. So finding little things that you can do to move, and your doctor and actually physical therapy team can provide you with exercises that you can do that aren't so taxing, but will still help to keep fluid moving
Right.
and keep that heart muscle doing what it should.
Exactly.
But the mainstay is, we want to be good patients in this. When we get this diagnosis, we want to be good patients.
Yeah.
We want to listen to the advice that's given, because really at this point, until we get unless you can get a heart transplant, which is generally not on the table,
Yeah.
it's difficult to manage, and it's a progressive disease state. So you end up at A, it's going to go to D at some point in life.
Right.
But it's what can we do to slow down the steps? A
Right.
to B, B to C, and C to and C to D.
Sure.
And so if we use the medications appropriately,
Yep.
talking back with your doctor if the drugs don't agree with you. As a pharmacist, that's where I have impact.
Yep.
And so I see people, hey, how you doing with drug A, B, or C? How's the combination? That's usually what I'm listening for when I'm talking to people at the counter.
Right.
Is it, how are you doing? Oh, I'm doing all right. Well, how's the activity level? It's been a little bit harder for me to get up and downstairs lately. Oh yeah, have you talked to your doctor? No, I haven't. I think it's time to probably have a quick conversation.
Sure.
And nowadays there's so many cool tools that patients have to communicate with their doctor. I mean, they can use it on their smartphones, they can use it on their computer, and the old-fashioned phone call and making an appointment.
Sure.
So you want to communicate changes right away.
Yep.
Because the sooner that they can make adjustments for you, whether it's a simple med adjustment or what have you, the sooner that you can hopefully get these things to calm down. Because the disease state itself fluctuates. You can have lots of good days in a row, and all of a sudden you have a flare.
Mm-hmm.
And there's no real rhyme or reason. We haven't at least figured out what may cause it. I mean, yeah, maybe I ate more of a salty food that I shouldn't have.
Sure.
So, I mean, those can be the obvious things, but sometimes it's not obvious. And so, for whatever reason, your body just said, we're going to swell, and we're going to make it hard to breathe. So you want to make sure we're addressing that. A lot of times doctors will give patients action plans where they want you to weigh yourself every day.
Okay.
When we get to the later stages, there's probably some fluid restrictions, and there's some dietary restrictions as
Sure.
well, because there could be other
Yep.
ones,
Yep.
cofactors in there that are creating some of these issues. So you really want to listen to what your doctor has to say, and be an active participant as a patient to make sure that you communicate when there are changes. They need to know ASAP.
Sure.
So I think that's kind of the key to managing it and to have quality life, because with the diagnosis, it can be scary and intimidating, but at the same time, you can still go out and enjoy your granddaughter's birthday
Sure.
or a wedding or, a friend's, whatever, a retirement party. I mean, life is still there to be enjoyed and lived, and it's not going to stop you as long as you are an active participant and make some of those changes and listen to your physician, your pharmacist, take the medications the way they want you to.
That's what I always find interesting, just knowing Chris, is the active positive role the pharmacist can have to recognize things or see that things. And sometimes you'll call a doctor and say, I think things are going well, but maybe these drugs are need to be changed or modified. And then the doctor, you communicate, have a conversation
every day.
Yeah.
I have that every day. And actually, where I work now, I actually do a lot of compliance backing. And so I see a lot of congestive heart failure now.
Okay.
I see more now in my 27 years than I've ever seen in my entire life.
Sure.
And so it's interesting to watch the interplay with the balance of the medications, additions and subtractions. And,
Yep.
and the key is compliance, guys. I mean, I can't stress this. I just had a conversation with a little old lady yesterday, and we sat down for 45 minutes, which so I'm not sure about my pharmacy partner if that was good for her workflow, but I took the time to spend with her. And so I think we've gotten them hopefully on the right track. I'm going to follow up tomorrow when I go back to work, but it takes time. You have to be an active participant in your medicine therapy. That's going to be one of the hallmark things that's going to help us to help you to keep going forward and enjoying quality of life.
Well, I tell you, where you work now, that service you offer, that aspect to the patients is just unbelievable. And people may not have that at every pharmacist. So if you do, you're fortunate, because it's going to be helpful. I mean, I always say Chris should be a doctor, because he has the heart for one, and he has the brains for one. And, those two things, that's what it takes.
I don't have nearly the education for that. So.
Yeah, well, get your kids out of college and maybe you can go back.
Yeah, there you go. Second career.
All right, very good. I think we got enough information for everyone to be educated.
Yeah,
and
hopefully
understanding it a little more.
Understanding.
Yeah,
I think that's the key.
Very good.
Thanks a lot, guys.
And we do have the giveaway, which we have a foot massager. Now, actually, this relates with some swelling we talked about with this video, because this actually massages your feet. You put them right in here, and there's some compression, which can get the circulation going. And it's a wonderful product. You have one.
I have one.
Bob has one. I don't use them because my feet don't.
What's your problem?
I don't know.
It just feels good, Brad.
Yeah, I know.
This is a great giveaway.
Yeah, it is. It works good. So go to bobandbrad.com, go to the giveaway section, and there they'll ask you a few questions, and sign up, and you could be the lucky recipient.
You won't regret it.
There you go. Be careful.